السلام عليكم ورحمة الله. بسم الله الرحمن الرحيم والصلاة والسلام على نبينا محمد وعلى آله وصحبه أجمعين. Okay, so let me get started. I'm Anis Koubaa, professor in computer science. I'm from Sultan University, leading the Research and Initiative Center and also the Robotics and Internet of Things Lab. I would like first to thank my team who also helped in the preparation of this presentation. And I will be glad and delighted to provide you today an overview about the digital transformation landscape in healthcare and what are the different opportunities and also the challenges. So, okay, let's get started from the strategic health sector objective from the Vision 2030, which is actually what we want to achieve during the next couple of years. And it's to achieve better health, better care, better sustainability, and better workforce. And we all know, we all have been as a patient in hospitals and so on, and we're facing a lot of difficulties and challenges that we all want to get them solved. And we don't see more than having digital transformation of the healthcare sector to integrate technology into the healthcare processes to optimize the performance of patients, to optimize also the experience of doctors and all the different workflows. So let me get started by this landscape of digital transformation in healthcare. And let's identify the main technologies, and probably one of the oldest technologies that it's telemedicine, which provides actually on-demand healthcare system. So I think all of us actually, we suffer, most of the things that we suffer in hospitals is waiting queues. We have to spend a lot of time for paying, for waiting for investigation, insurance approvals and so on. All these kind of processes actually, if we integrate very well telemedicines, they can help in optimize the patient-to-doctor interaction through telemedicine systems, and also can improve and promote the healthcare availability in remote areas, like for example rural areas, and even in poor countries that they don't have enough doctors, for example, to make use of big data. You know, now we have tons of data, huge amount of data, trillions of data coming every day. And one of the things that we can do with data is doing predictive analytics, predictive models. So, for example, we can estimate more accurately using a huge amount of data, for example, the lifetime expectancy for some kind of diseases, for some kind of ethnicity, for some kind of genders. All of this, if we use effectively data analytic models in the healthcare sector, we will be able to have more accurate estimation and predictions about certain diseases, and even more in different type of workflows as well. It can be also used predictive models to optimize the waiting times, the admission rate predictions, and so on. So Internet of Things, it has been also a viable tool for monitoring patients remotely. For example, in many countries where there are elderly people that live alone, they can put some kind of sensors connected to the internet, for example, for fall detections or any kind of diseases. They can be monitoring in real time through the internet. And this is what we call the Internet of Things, where we have sensors. And most of us now probably have sensors like these Apple Watches and smartwatches that we have now. They have different type of physiological data that can be also shared through the internet and with doctors. Virtual reality plays also an important role in digital transformation. It has been used extensively in teaching and education. I'm going to show you a sample of videos illustrating this concept, and also in pain management and physical therapy of patients. The market is expected to $7 billion by 2026, so it's kind of a huge market, especially with Meta and Facebook has invested a lot on metaverse, which is based on virtual reality. Now, the big buzzword is artificial intelligence, and artificial intelligence is like disruptive technology right away. And it has been used in several applications like diagnosis, pathology, management, drug discovery. That's one of the emerging technologies right now using artificial intelligence. I'm going to give concrete examples on this. In some of the cases, also some of the hospitals have used Alexa. Alexa now has been invading our homes for automatically controlling several of our smart devices, but also it has been used in some of the hospitals in AWS and Berg for improving the hospital interaction between patient and also nurses. And drones, also that's one of the interesting topics. There has been a lot of robots that are used in hospitals, especially, for example, for the delivery of drugs between different departments. And many robots, especially after the area of COVID-19, have been used into the disinfection. That was one of the most popular use cases of the robot recently. And drones, they were also used in the delivery of medicines, of also blood samples. We have also made a proof of concept with the Ministry of Health on delivering blood samples using drones, and probably very recently we're going to have another bigger POC on the use of drones for the blood sample delivery between different areas. And now, the biggest trend right now is the large language models, ChatGPT and all these kind of variants. I'm going to show you what this technology can do. I think the previous presentation also have shed the light on the use of ChatGPT. But we are still in the beginning of this technology, and we can see a lot of potential in using large language models in the diagnosis support, in medical research, in patient engagement, and also administrative efficiency. Okay, so large language model, I'm going to spend a little bit of time talking about their capabilities. So I'm going to show the application of VR, but in the next slide, just to summarize the importance of digital transformation, it can help in enhancing the care coordination between patient and also doctors, enhance the patient experience, connect patients with doctors, especially in remote areas, and improve efficiency. So let me get started with some of the use cases of telemedicine. And just a few years ago, maybe 2 or 3 years ago, with the emergence of 5G, China has made the first surgical operation using 5G. And this has actually will enable a lot of potential for remote doctors and on-site doctors collaboration, especially in areas where they don't have qualified doctors for doing advanced surgeries. So this is one of the prototypes developed in a UK university from one of our colleagues and collaborators, where they provide a real-time patient physiological data device that will allow the real-time monitoring of patients, especially in remote areas. And this will enhance the accessibility and continuity of care for patients who don't have direct accessibility to hospitals. But this actually, telemedicine comes with a lot of challenges, and especially security. Now, just to give you a flavor, 30% of large data breaches occur in hospitals worldwide, among all different other sectors, which is a huge number. And 51 of the healthcare organizations reported an increase in data breaches since 2019. So these should be taken into consideration, and look at the numbers of the industry cost of data breaches. It's actually reaching 9.23 million, which is a significant increase as compared to 2020, 7.13 million. So telemedicine, it provides a lot of opportunities, but still these challenges have to be taken into considerations. So virtual reality, I will show you just a couple of videos showing the potential of virtual reality in education, and in education, also in pain management, and also in rehabilitation. These are 3 videos. The lowest one, it will help rehabilitation of patients. And the first one, it will help in the education of medicine through interactive manner. And also it has been used extensively in pain management, because when a patient will have the VR device, so all the nerves will be actually concentrating on the 3D animations more than on the pain, so it will be able to alleviate. And 80% of the patients has reported that there is an improvement in terms of the pain management. But this comes up with some challenges as well. The cost is not accessible for everyone, and there are also ethical considerations that should be also taken into account. Integration with existing system is not obvious, and there is no clear evidence validation of the effectiveness of these technologies on all type of patients. Now, this is like the biggest part of the talk, which is about AI. And you can see the amount of market size that is projected by 2030 is going to be about $208 billion US, which will have a major 3 times increase as compared to 2020. And AI, basically now it becomes pervasive in all our daily life. And especially with the release of large language model ChatGPT, the evolution of this area has, it has been extremely fast as compared to any time before. And there is actually a lot of potential, but still there are many challenges. And for example, this is one of the recent studies that we have made, is to use AI and ChatGPT to automate diagnosis of X-rays pictures. So here, we're going to use a traditional convolutional neural network to make a diagnosis on an X-ray, and it will actually provide a label, a classification, whether it's a normal case or there is a disease. And it will be able to detect the disease with a high confidence. And based on this, we're going to use large language model like ChatGPT with additional information about the patient in order to automatically generate a diagnosis report. And we've done an experience so we have trained a large model on different type of X-rays and with different type of disease, which I'm going to show right now. So this is the first model that we have built. We've taken a lot of pictures, tens of thousands, and we've made the labeling of these pictures. And finally, we trained a neural network model to, so this is the size of the data set that we have been used for different type of diagnosis. And so this will be the input, which is the X-ray image, and the output of the system will be a detailed medical report about the X-ray image, so a complete diagnosis. And we have validated this by special doctors, and we have confirmed what was written by ChatGPT. Of course, I'm not claiming that this is a ready product and it's ready to go to the market. As it was said in my previous presentation, there are still a lot of challenges, but the initial results, these are just initial results, are very promising. They are very promising that they can help healthcare professionals to at least, if I don't make the real diagnosis, they will help writing the report in a proper manner. And I would like to give one rule that I tell every time I make a presentation on artificial intelligence. AI is not here to replace human. AI is here to assist human. If we put this in our mind, we're not going to have any fear from AI. I don't have any fear from AI because I don't have any doubt that AI will never be able to replace me or any other one if we use it properly, just to help us in making right decisions. Because AI, like human, it may also be wrong. So we can consider this as an additional opinion rather than an exclusive opinion that we have to follow. This is the rule that we should have in mind when we deal with any AI system. Any AI system is prone to error in any kind of area. Even if this error is small, we have to be careful, especially in critical areas like the healthcare or even other areas. Like in self-driving car, we rely on AI, but still there are some accidents. Probably these accidents are less than human, but when an accident happens, it's not going to be very funny for people to have. This is also another medical report for another type of result of diabetic macular edema from OCT scan image. And it was able to generate correct report. Of course, these are some initial results that we are sharing. So another direction for using ChatGPT with healthcare is to use prompt engineering in order to help healthcare in addressing some of the interactions. Okay, so now there are some websites that provide different type of prompts that will help healthcare professionals to automate some of their processes. So let me show you a few samples. For example, we can use these prompts, explain a certain medical condition in a simple language for a newly diagnosed patient. So usually some patients, when they come for the first time, they need to understand their situations. So ChatGPT, it can help providing explanation in a very simple manner, okay, so that we can share with patients. Okay, this is describes the treatment option for a particular medical condition. Also, these are some different proposals by ChatGPT. And it can help addressing some patient concern and questions, okay? And these are just a couple of samples I will be happy to share with you if you are interested. And now we are receiving a lot of requests from different sectors, not only from the healthcare, about how we can take benefit of large language models in order to automate some of the processes. Another important thing also that I would like to share with healthcare professionals is the use of generative AI in drug discovery. It started with gun, but now there are more sophisticated techniques that will actually help reducing the cost, because there was a statistic the cost of one medication, it can cost up to $2 billion. And this is very expensive. And now with the use of AI, we can decrease this cost. Okay, thank you very much. So finishing by the use of drones in healthcare. So this is one of the POCs that we have done for the Ministry of Health, where we have demonstrated the use of drone for delivery of blood sample and maintaining the required temperature for the blood sample. Okay, thank you very much.